Hey, everybody, it's Natalie Bencivenga, and welcome to another edition of Facts Over Fear. Now, you guys, I know that there is so much coming at us in the news cycle right now, but there are actually a lot of issues that right now I feel are getting a little bit swept under the rug, and in particular ones around bodily autonomy, reproductive justice, and choice. You know, when we talk about reproductive rights in America, the conversation is usually centering around abortion, and for good reason. But there's another side of the story that gets far less attention: the right to have children and who can actually afford to do so. So fertility treatments like IVF can cost tens of thousands of dollars, and most insurance plans still don't cover them. That gap has created a booming fertility industry and now a new wave of financial products designed to help people plan their reproductive future are hitting the market. One example is Lotus Fertility Insurance, which offers policies meant to help to cover fertility treatments through its platform, Fertility Project. Now, on the surface, solutions like this are empowering. It's a way for people to protect their ability to have kids later in life. But through a reproductive justice lens, we have a lot of questions that still need to be answered, because why is building a family treated like a financial risk to insure in the first place? Who gets access to these tools? Who is left out? And how can some of these products create a sense of equity? What does it say about our healthcare system that reproduction increasingly depends on private financial products instead of guaranteed care? And who's centered at the first of that? So today we're exploring the intersection of fertility, of money, of reproductive justice, and what it means when the ability to have a child becomes something that you have to insure. So joining me today is Callie Myhrum. She is the founder and CEO of Lotus Fertility Insurance. Callie, thanks so much for being here.
Thanks for having me, Natalie. Great to see you. Hey, everyone.
Oh, it's so great to see you, as always. And, you know, you and I have become friends. And what I think is really special about our relationship is we have just really open and real and vulnerable conversations with one another. And I thought this is the perfect space to talk about your work and how you found your way into the space and how you're trying to do things a little differently, which was really what I wanted to focus on, what sets you apart from some of the other players in this game. So would you share with everyone a little bit about your own journey and how it brought you to Lotus Fertility Insurance?
Yeah. Hi, everyone. I'm Callie. I'm founder and CEO of Lotus. And my journey really started a couple of years ago when I was looking to, I was navigating my own chronic health issues with endometriosis and exploring fertility preservation options for myself. I wanted to freeze my eggs. I also had tens of thousands of dollars in out-of-pocket expenses from health insurance not covering some of the ongoing issues that I had. And I went to the individual market to look for a supplemental or a gap insurance that would help me plan for the future. Like, you have critical illness, like you have cancer insurance. And it just didn't exist. My employer at the time didn't have any fertility benefits either. So I went to the individual market to look for a supplemental policy. And the surprising realization is that the absence of fertility insurance wasn't really due to a lack of financial or technical feasibility, but it really was about systemic blind spots and deeply misaligned incentives. So I don't come from an insurance background, but I became so obsessed with solving this problem. I didn't actually end up freezing my eggs, but I did use that money and pay an actuary to build a model to prove to do it. So yeah, there was this core fundamental question for me, which is how is it that there is this massive gap in the market for one of the most significant life events that a person can plan for? And on top of that too, I'm like, you cannot tell me that we can figure out pet insurance, but we can't figure this out. So that motivation is really, that was really what started as curiosity really led to conviction that the business model for this exists. We just haven't applied it to fertility yet. So that's a little bit about me and my journey to starting Lotus.
Wow, that's really so fascinating, because I always just say, if you want something done, ask a busy woman, because it's like, we will figure it out. We will make it happen. When we're looking at this through the lens of reproductive justice and all of the things that you said, how does the fertility coverage or the lack thereof it shape who is able to start a family in the United States? Because to your point, you ended up putting that money that you had set aside in order to build this other product so other people who want to do this might have a shot at it. And we also know that freezing your eggs isn't as good as freezing an embryo. So there's all these like
Hmm.
layers within layers of, how this works best and who this is really set up for. So can you talk a little bit about that intersection?
I would say, great question. The lack of comprehensive fertility coverage turns this fundamental human right of building a
Mhm.
family into a conditional privilege that is really dictated by wealth, dictated by race, sexual orientation,
Mhm.
and to an extent geography. In the US, the healthcare system currently treats fertility care, or has historically treated fertility care as elective procedures rather than a medical necessity. So this really creates this system of stratified reproduction where the family building goals of affluent, often white, heterosexual couples are supported while marginalized people are really priced out of it. So
Mm.
the average that with the average cost, average out of pocket cost of fertility treatments can hover around $66,000. I've heard into the six figures
Wow.
as well. Those without vast personal savings or resources or, elite employer benefits really are systemically included from care.
It's it's funny that we're talking about this because I don't know if anybody watching enjoys Bravo, but I do.
Mm, mm,
And I was watching an episode of The Real Housewives of Beverly Hills recently, and
mhm. Both.
She has been very transparent about her fertility journey and the
Yes.
struggles and
Yes.
how hard it is. And she's a woman in her late 40s and
Mhm.
the challenges that it takes to overcome. And she, had just gone through another round and it wasn't successful. And this is a woman in a very specific economic bracket. And even
Mhm.
she was saying, like, look, there's only so much money I can pour into this because it is so, there is just no guarantee that any of this is going to work. So, how does that factor into an insurance model when you are dealing with a population of, older people who are trying to get pregnant, for instance, or people like you said that may have chronic health issues? That's got to make it more challenging to insure. So, how did you convince people when you were pitching this as an idea that's viable that this is a sustainable business model from a private insurance perspective?
Yeah, I think reframing it as something that this is something that people can financially plan for.
Hmm.
When it comes to a risk related product, like we're not building a financing tool.
Hmm.
A lot of the products that are available in the market today are financing tools, right? Somebody who already
Mm.
knows that they have an issue and they have pending treatment and they need to figure out a way to finance that treatment. Our current system is, that there's it's deeply misaligned. There's some fundamental flaws in how we treat fertility care today. That it's,
Hmm.
one reactive. 1 in 6 people struggle with fertility issues and, need to visit a doctor's office in order to build a family. And we've already talked about the staggering out of costs,
Hmm.
expenses that can be. But the problem is that people are getting treatment after a problem
Mm.
arises. And the second, and probably more importantly, is that the healthcare system benefits from it being that way.
Right.
It's a system that profits from reactive, expensive care, and there's
Mm.
not an incentive to keep people out of the costliest part of the fertility journey. So,
Mm.
really, so with carriers, it's like that's their first question: like, is this an insurable risk? And it's like, yes, but you have to build a product that fundamentally realigns the incentives in the system. And financial planning for fertility is fundamentally about empowerment.
Hmm.
It also, like I was saying, highlights this glaring failure of our current healthcare system. Because traditional health insurance largely ignores the female anatomy and treats infertility as an elective issue, the financial burden is entirely offloaded to the
Yeah.
patient. So
Mm.
at Lotus, what we're doing at Lotus is that we're using a life insurance chassis to give people a proactive financial safety net before a problem arises.
Hmm.
So it's you have to fundamentally realign the systems and fundamentally think about risk differently. So
Yeah.
that's a lot of the work that I do with carriers, with regulators, is reframing the problem statement because really it's our understanding of the problem statement that is holding us back from true financial protection and coverage.
I mean, that makes total sense to me. If you're just joining me, I'm Natalie Bencivenga. I'm here with Callie Myhrum. She is the founder and CEO of Lotus Fertility Insurance. So I want to take a larger national lens on this issue because President Trump, every good question starts with that, referred to himself in 2025 as the father of IVF and the fertilization president, which is a whole other thing to say, emphasizing his support for the procedure, especially after it became a very politicized issue in early 2024. Now, you and I have talked a little bit about this offline, but you're obviously very much engrossed in policy right now. Have you seen any movement on this front in terms of legislation that would help to ease the financial burden off of the individual? Or did he just sort of say this as a soundbite to get people intrigued and then move on to something else?
I don't think he even knew what IVF was before
Fair.
2024.
That's totally fair.
and and he's he's a lot of things, but he's also a populist. He's going to do what is popular for the people that are supporting him. And so he did sign an executive order in February 2025 aimed at expanding access and reducing out-of-pocket costs for IVF. He gave his administration a 90-day deadline to come up with some answers, and was just crickets. The order. It framed the order. The order framed designating IVF access as a White House priority. He really ran on that as well. And some suggestions that were out there were suggesting floating around, like extending coverage to military members or making it an essential health benefit under the ACA. But an executive order is a first step, and it's not a comprehensive solution. I think this is also when we saw, I don't know exactly when in the time frame it was, but when they did come out with a response, it was really about putting more of the burden on employers to pay for it. And this is, I think, also around the time that we saw him announce Trump RX.
Yes.
So and how he was going to drastically reduce the cost of fertility medications for employers and for people who are paying out of pocket. So I would just say that any move that he makes is not going to be genuine or altruistic. Like he's only going to make moves where he stands to gain financially. And so that's we haven't seen a comprehensive solution. We have not seen a guaranteed protection of IVF access. We have not seen any immediate mandate of insurance coverage. And also, critically, we have not seen any prevention or any guarantee to prevent discriminatory policies against LGBTQ people or non-traditional families. So I think there was a lot of smoke and mirrors there for, making it look like he really cared about it, but he wasn't. He wasn't consulting Resolve, the National Infertility Nonprofit Organization. He wasn't consulting the ASRM. He wasn't looking to experts in the field to actually come up with real solutions. And meanwhile, at the same time, broader federal efforts like the Right to IVF Act have faced significant political roadblocks in the Senate. And I think some of the most recent legislation came out just denied IVF for military members. So there's a lot of noise out there, but in terms of meaningful legislation, I'm not sure he's really going to be the one moving the needle on this, unless he stands to gain personally from it.
Right. And I think that really is the key there. And you had brought something up around the price tag around equity, in a sense, particularly for low income people, LGBTQ family, and single parents by choice. How would your product really start to level the playing field here a little bit?
Well, on the equity piece, what does this mean? What does the price tag mean for equity? Right? Like a $66,000 price tag means that family building is largely inaccessible for the most vulnerable population. For low income individuals, it's an absolute wall. It's also exacerbated by the fact that 42 state Medicaid programs cover neither the diagnosis nor the treatment of infertility.
Oh.
So, for LGBTQ families and for, single parents by choice, the inequity is really like built directly into policy language.
Mm.
So traditional insurance definitions of infertility often require 12 months of unprotected heterosexual intercourse, and completely ignoring other ways of building a family. Um, so, did that answer your question, or how?
No, no, absolutely. I think, what intrigues me about what you're doing, Callie, more than anything is really how it intersects with all of these other issues around
Mhm,
reproductive rights, because we hear a lot about the family, the family, the family. But when we're
mhm,
actually, like you said, trying to create policy and provide choice for how and when and if you choose to have a family, they seem to be limiting it and limiting it and limiting it to become, like you said, this very heteronormative, white experience, affluent experience. And so when we're talking about all of that at the same time that we've seen, abortion and gender affirming care and all of these other things related to gender and reproductive justice in many states, especially after Dobbs' decision came down, and that was horrifying. How do these trends then intersect in the broader fight for reproductive justice? Because I see all of these things, infertility, abortion access, gender affirming care. To me, they're all sort of part of the same tree, like they're
totally.
branches, but it really comes down to bodily autonomy, right?
Yeah. Yes. I would say, the restriction of abortion access poses a real existential and legal threat to the practice of
Mm.
IVF.
Mm.
Following the Dobbs decision,
Hmm.
we've seen the rise of fetal personhood laws, which
Yeah.
seeks to grant full legal rights to embryos from the moment of fertilization.
Hmm.
The most glaring example of this was in 2024 when the Alabama Supreme Court ruling classified frozen embryos as children.
Yeah.
And what happened is that immediately halted IVF services in the state. Because standard IVF practices involve creating, genetically testing, and sometimes discarding unused embryos, personhood laws make the underlying medical science of IVF, really legally perilous. You cannot separate the fight for abortion access from the fight for assisted reproductive technology. They are the two side. They are two sides of the same bodily autonomy coin.
Hmm. No, and I really appreciate you laying that out very plainly, because I don't think a lot of people still understand how the choice of how and when to reproduce is intricately tied to what is
Absolutely.
happening, with our Supreme Court. Um, as we're wrapping up, and I really appreciate you taking time to chat with me. I always feel like I learn so much when we have these conversations. I want to talk about that a little bit further, that pull that thread a little bit, because we
Mhm.
were discussing reproductive justice. There's movements led by activists like Loretta Ross that emphasizes three rights: the right to have children, the right to not have children, and the right to raise them in safe communities. How
Mhm.
well does the current fertility industry support or really undermine these issues as you're seeing it? Because I look at you as sort of, I want to say, a disruptor in this space in the terms of how you're framing your work.
Yeah. I would say the current fertility industry largely undermines these core,
Mm.
principles of reproductive justice because it is fundamentally structured around profit and privilege.
Hmm.
The industry currently caters to a demographic that is predominantly white,
Mhm.
affluent, and married,
Mhm.
while women of color disproportionately experience infertility but lack access to diagnosis and treatment. And like I was mentioning earlier, the clinical and business models incentivize expensive reactive treatments like IVF over proactive education and early diagnosis and affordable intervention. So to truly support reproductive justice, the industry must shift towards equitable access, inclusive definitions of family, and preventative care that
Mhm.
also values everyone's fundamental right to be a parent. And
Love
and
that.
and I would say too, just on the insurance side, we're not shifting responsibility away from healthcare.
Mhm.
We're stepping in to
Mm.
provide true financial risk protection where healthcare system has completely abdicated its
Mm.
duty. So from an insurance perspective, and proving that this is an insurable risk, by transforming a catastrophic $66,000 medical expense into a manageable, predictable premium, we can really empower individuals to reclaim their autonomy.
We definitely have to do more of these because I know there's just stuff we've just scratched the surface on that we could
Just
go
scratching.
so much deeper. I just want to wrap up with asking you this because you touched on a few points here, but I'd love for you to just be a little bit more specific in your answer here. If the United States treated fertility care as essential health care rather than as optional services
Hmm.
for the privileged, really, what policy changes would that require? Because when I heard you say preventative care, the first thing I think of is universal health care, because
Hmm.
meaning, all of the chronic issues, all of these, like you said, everything's very reactive, but instead we need to be more proactive. So I have to think about, those catastrophic medical crises that wouldn't have to be if people had access to care. I think
Hmm.
about something like paid leave
Yeah.
because,
Yeah.
right now we don't have a national maternity, paternity, family leave on the books. To me, that would be something that would really help in terms of a policy to help then ease the burdens after you
Yeah.
bring a child into the world. So I'm looking at it sort of as this connective tissue. But when you are thinking about this specifically from a policy perspective in this moment with IVF, what would that look like?
Loaded question. Love it though. Treating fertility care as essential health care
Hmm.
would require a complete overhaul of how we define and mandate coverage.
Yeah.
Um, First, we would need federal and state mandates to adopt inclusive definitions of infertility, ones that the ASRM, the American Society for Reproductive Medicine, have already laid out.
Hmm.
We would need to be removing heteronormative barriers so that LGBTQ plus and single individuals have equal access to care.
Hmm.
So from those types of federal and state mandates, we would need to see kind of who is defined as deserving of healthcare.
Mm.
And second, we would need to. There are specific loopholes in the employer landscape that allow self-insured employers who cover roughly 61% of U.S. workers to really, that there are loopholes that allow them to bypass state infertility mandates entirely.
Mhm.
Um, and finally, I would say public health programs like Medicaid would need to comprehensively cover fertility diagnosis and treatment to ensure that lower income populations aren't left behind. So when I look at the healthcare policy and the healthcare landscape related to this, that was a huge driver for me building this in the financial space. Like we're not,
Yeah.
as far as how our product is filed and regulated, it's not a health product; it's a financial product. And for me, that's very intentional,
Mm.
because then it's not regulated the same way that a health product would be regulated because the system is just glaringly
Yeah. There's just too many
insufficient.
fragmented spaces. It would be hard to navigate. That makes total
Correct.
sense to me.
Correct.
So if
Mhm.
somebody maybe listening has questions or thoughts about this in a more personal way, where can they go to learn more about your work and your product?
Yes, you can find me on LinkedIn, Callie Myhrum. We're also on LinkedIn, Lotus Fertility Insurance on LinkedIn. But people can also visit our website at www.insuredbylotus.com to learn more about our mission and our product and how we're helping carriers change the landscape of family building. And you can sign up for our monthly newsletter as well. I'm going to be posting here more on Substack, so you can find me. You can find me on the channels.
Awesome. Well, you'll
Yeah,
definitely have to come back and we'll have to chat more
would love
because,
to.
oh, yeah, I think there's so much more to dig into. I mean, we could have spent a half an hour just on one of these questions as a deep dive. So
Hmm.
I would love to
Totally.
have you back again. And thanks everybody for tuning in. If you tuned in late, don't worry. I'm going to be posting this later tonight on all the platforms here, YouTube, Spotify, Apple Podcasts, all the spaces. So be sure to check it out. And please subscribe to us both above now that you heard Callie's going to be here more
Do it.
regularly too.
Do it.
And until next time, everybody, as always, please take care of yourselves and each other. Have a great night. Thanks, Callie.
Thanks, Natalie. Thanks, everyone.